So I have everybody knows her as Madison Miranda on Instagram for all of her cooking, but I know her as Madison, as one of my patients who's almost 2 years out from explant. So thanks for joining us, Madison. It's long overdue.
Yes, thank you for having me. I'm so excited.
Now we were talking offline. I see her more on Instagram making recipes, and we're gluten free and dairy free, so I'm always looking at and sending her recipes to my daughter and my wife. They
Oh,
seemingly are constantly making something off of an Instagram
that makes me
recipe.
happy to hear.
Yeah, it's fun. It's awesome. So, we've shared a bunch of different stories over time. And since you're 2 years out and you said offline, probably this has been, from a timing perspective, best because you said you feel really good now. And
Yeah,
I think most folks are pretty, as you would imagine, impatient. They want to feel better really quickly after surgery. And I used to let everybody know in difficult situations from trauma or cancer reconstruction or a bad infection that many times it takes, several months. And in your case, you're coming up on 2 years to feel better after that. So maybe just
totally.
explain that for everybody.
Yeah, so I mean, I obviously was really hopeful that after the removal, I would feel better overnight. And I feel like I've seen a lot of stories online of girls feeling better the second they wake up from a surgery. And for me, that was not the case. I definitely had symptoms that cleared up kind of immediately, but it was a journey for me. I think, first of all, I'm someone that doesn't even take Advil. So I think the whole anesthesia and pain pills and all of that stuff that I was on, and I don't know if you remember, but I was a special case that took a lot of all of that stuff.
Yeah. So many times, like to your point, either people they metabolize things differently, and we
Yeah,
look at it from genetics, but some folks need what you would consider to be a lot of medicine to be comfortable,
totally. And that
and
was,
that was, yeah,
yeah.
absolutely.
So I feel like the first few months for me was honestly just detoxing all of the stuff from the surgery, and my energy levels were really low. It just took me a while to feel like myself again, to be honest. Um, and one of the bigger reasons I went into explant surgery, which is such a long story, but I had health issues. I've had my implants for 10 years about before I decided to explant. And it was about 3 years before I explanted that my symptoms really started. So I really felt okay, right? For the first 6 or 7 years that I had my implants.
Sure.
And then it just overnight, I feel like just switched and I had extreme bloating. I couldn't, headaches. Every time I ate, it was so uncomfortable. I developed a gluten intolerance. My dairy allergy got worse. It was just
Do you
chaos.
remember like an event that maybe was something that was the trigger or the tipping point or whatever? Like
Yeah,
I just, you know,
I really think it was my mom passing away. I think
okay,
emotionally it was just too
sure.
much. I think my implants obviously probably was causing inflammation in my body all along, but I felt okay. And I think when that happened, everything just went downhill from there. And I tried so many things before I got to the point of explanting, right? Because obviously I didn't want to right away. And I was going to naturopaths and MDs and doing blood work. And I would take all the supplements and do all the protocols, and nothing was working. So I got to a point where I was finally like, it has to be I have to get them out. And yeah, when I did, the symptoms that cleared up kind of automatically were the gluten intolerance. I was able to introduce gluten back into my diet. I still try to stay away from it, but like when I travel and stuff, it's nice to be able to
Sure.
not worry about that allergy. Um, and bloating went down like crazy for me. Like I literally used to get so bloated where I would look pregnant. Like I'm not even exaggerating. It was insane. It was uncomfortable. I don't have that anymore, which is a huge thing that I'm very happy cleared up. And yeah, that happened pretty quickly, but the weight loss for me has been a journey, but I'm finally at a really good point and I'm down 35 pounds and I'm really happy about that.
Yeah, you had mentioned that previously in one of our little communications, and everybody will get there. Uh,
Yeah.
I'm confident. And now the timing of it, none of that is a race. And to your point, a lot of folks, And I don't ever subscribe to that waking up and everything's going to be, rainbows and
Right.
unicorns, because that's just not realistic. I've had one or two patients, obviously very, one of them very high profile, who did that.
Mm-hmm.
And that's just a very specific set of circumstances. Maybe somebody had an infection, or somebody
Right.
had a leaking implant, or somebody had X. And I
Mm-hmm.
do a case, and then that relieves a lot of strain stress from their system.
Totally, that makes sense.
And then they wake up and they're like, those are special, specific instances. That's not
Yeah.
the majority, and it shouldn't be, thought that way. Your story, I like it in that you're very realistic, that it's taken that period of time and you haven't gotten short or frustrated with yourself
Yeah.
over that time, because a lot of work obviously goes into that on your behalf. And
Totally.
that's the most important part.
Yeah. I mean, I was definitely feeling a little frustrated at some points, but I was feeling better, you know? So it's like just because the weight loss didn't happen, well, the bloating cleared up and that was a huge thing. So I knew my body was happier because of the decision I made. So I just had to trust the process. Like, you're going to get to your end goal. You're already feeling so much better. It's sometimes like when you have an end goal, you forget to like look back at how far you've already come, you know?
And you already you use one of my biggest cheat codes, which is you already understand nutrition. So that's such a cheat code for me, because if I get you sleeping better and eating better,
Yeah.
those are huge elements in overall feeling better. Like,
And I also want to say, I feel like I, when I woke up from surgery, I thought I was going to be like not mobile for weeks. And I was like fine. Like, you do the nerve blockers, I believe. Like, of course, I was in discomfort, but I think the most discomfort was from the fat transfer part, which was like the swelling of things. But like, I was really impressed with how mobile I was right after my surgery.
yeah, we work really and continue to work really hard to make sure that that's always the case. So you want to get up and move, and the exercise is always being able to walk and move around and not be sedentary, not be, stuck, because then you get stiff. And,
Yeah,
if you're old like me,
you're
56
not
now,
old.
the more you kind of get in one position for a longer period of time, it makes you feel bad.
Yeah.
And you want to be moving and staying mobile. And, you talked about, doing fat transfers, and you have a very nice result. And the more I can provide a, simultaneous uh, fat transfer to help in that transformation, I would like to do that. We have a specific program with Sharp to get everybody set up for more success with that. But it's not there's a lot of fear mongering about fat transfers, and like,
Mhm.
oh, it's not going to work. And, oh, why does Dr. Whitfield say, why does he say he can get it to work and nobody else can get it to work? And there's
Mhm.
all this shit that goes on and on and on about it.
Well, I mean, I will say that I've lost the 35 pounds, and what stuck in my fat transfer has stuck. Like, I was a little bit worried of losing weight that maybe would, like, I don't know, go away, but that has not been the case for me. I am what I was. I mean, after surgery, there was some swelling, but I would say about at the 3 month mark post op, I'm still the same size as I was then for my breasts, which is amazing.
So you're swelling and things so Madison's talking about her, like, overall, her body had some inflammation and she was able to release that inflammation and not sacrifice fat, because that wasn't the problem. She's
Right.
talking about fluid and loss of fluid in that process. And I just was on a call with somebody out of state, Madison, and they haven't lost that fluid weight, and they're like, they're a little bit, further out from surgery. And I was like, it's going to happen whenever your body kind of gets healthier and feels better. I mean, this will happen. It's
Totally.
going to happen. So maintenance of a result. Now, so for everybody listening, when I did Madison surgery, she's about 27 years old. So it's a little bit different than if you're, in your 50s like me. So she's my best case scenario for a simultaneous fat transfer, because when we're younger, our hormones are in better uh, balance. Our metabolism, our ability to tolerate things is better. We have more resilience. And then as we age, more and more we rely on looking at and being very specific on your genetics and your gut health and your sensitivities to different, environmental toxins or mold toxins or food or whatever, to try to make sure that kind of what she's describing is what we want everyone to experience. We don't want to experience fat loss. And there were papers published recently, Miranda, that look at changes in BMI. And if you go down in BMI, not like fluid weight, but like
Yeah,
lose, muscle mass or body fat, then your fat transfer result is lessened. But if you
interesting.
go up, like even a point of
Yeah,
BMI or two, then you retain close to 80, 85% of the result, which is more of what you're describing. Like
yeah.
what I transferred is what you maintain.
Yeah, I definitely think I like held on to 80, 85%. I've seen some people online say you only hold on to 30%, and that's not the case for me at all. So,
Right. It's more about, and so, how from a diet perspective, I feel like it's very hard for me to get everybody, focused on that, because you can't want to then go do a calorie deficit and hit
yeah.
and cycle or run. I tell people,
Yeah.
no, it's not going to work.
I mean, and it also comes down to, like you said, like the diet you want us to eat after is so important. You cannot be trying to get inflammation out of your body and eating dairy and drinking alcohol and eating gluten for every meal. Like it's not going to work. And I personally feel like if you're going to go through this process and spend all this money on your health, like at least do the diet properly. Like why not give yourself that extra, benefit? And I don't know. I really think it's really important to just be really kind to your body and eat right and be on an anti-inflammatory diet during
Right.
this time period. And I think people would have really good results.
Yeah, and Madison knows how she's basically everything you show on your social media platform is basically the tips and tricks to eat really healthy and avoid the things that inflame us. And
Totally.
the well wasn't open, I don't think, when you came.
Because I did it over Christmas time. So things were kind of,
Yeah, so the
but
gluten-free dairy-free place with no seed oils, the well here in Westlake. There's one downtown. So the downtown location was here when you were
okay.
visiting us, but now we have one within like 5 minutes of our office.
Oh, that's nice. I brought my sister and she's also an amazing cook and she made me lots of, and we're all, my whole family, we're all very mindful of all that kind of stuff. So I
Right.
was in good hands.
Yeah, but that is the biggest, you know, I prioritize sleep, and then I talk all about, nutrition and what to do, and both from the macro standpoint, which you talk about a lot, and then the micronutrient standpoint. And then when we have people who have maybe swelling, or maybe they're having pain, or maybe they're having neuro symptoms later on down the road, I always worry about what are they not getting, what,
Totally.
what are they not absorbing through their diets, and how can we help them? Because all things being equal, it's fine to have some areas that don't have uh, you know perfect sensation after surgery because you had surgery. That's
Yeah.
okay. But you really, if all things being equal, if you're getting your rest and eating properly and supplementing properly, you have a really good chance for success, and doing, just like Madison has been able to do over time and get really well.
Hmm.
And obviously, that's what I mean. I want that for everyone. Now, the thing that Madison talked about, I haven't had people bring up, but I know having a loss of a family member, a loved one, a spouse is a very huge deal in terms of stress,
Totally.
and it can definitely trigger, symptoms. I've seen, physical events, but that's a very, important life event that can definitely um, stir up a lot.
Yeah. And I kind of think it's like, when people say they feel okay, right? Like maybe someone eats fast food every day and they think they feel okay, but you don't know what okay is. Like your okay could be so different than someone else's okay, if that makes sense. And I think I felt fine and I was getting through the days, but I just think internally my body was clearly not fine. And one major event, like my mom passing away, just kind of tipped everything over and derailed the whole train.
Yeah, that's a huge life event.
Yeah.
And you're a young person. I lost my mom when I was in my 20s. She passed
I'm
away.
sorry to hear that.
But that's a very big, and you don't really probably fully realize how much it affects you until you're, maybe further beyond it, and you look back
Totally.
and go, that was a mess.
Yeah, honestly.
That was a big problem. I remember I went and I spent my entire first year of surgical training, and I just worked all the time, and that was
Mhm.
probably, that was my distraction from that problem.
Right. Yeah.
And then after I thought about it like a year or two later, I was like, I had to have been depressed during that whole year.
Right.
And then it finally occurred to me, I was just like, oh, I guess that was the case. I was
Hmm.
about 26 years old when that happened.
Yeah. It's horrible.
Yeah.
I also wanted to kind of touch back on what we were saying about the healing process. And I just want to say, I love the protocols that you have in place for your patients post-op. I think they make all of the difference in the world. Not only do you make sure everyone's set up by doing blood work before, you have, at least when I was there, you had like a naturopath to work with before and after surgery. You have the hyperbaric oxygen chamber. When I was there, you had the Balancer Pro. I saw that you guys have a new device now, but I
Yeah.
really think all of those devices and protocols you had in place is so important. And I interviewed with other doctors before I found you, and that no one else had any system like you had in place. And I think that's really cool. And that was one of the main reasons why I did decide to go with you, because it felt like you cared about the patient past explant. Like you wanted people to feel better.
I think you gotta do, and thank you. I think we've worked hard to put in systems to help people get prepared, and then
Mm-hmm.
certainly afterwards. But we're emphasizing how much we get your preparation done. Looking at genetic testing, like you said, blood work, looking at hormone balance and food sensitivities and gut testing and toxin testing, trying to see like what does Madison have that we can help with before she comes over. And
Totally.
when you're here, now we have something new called the human regenerator,
Sounds like fun.
and you lay on it, and I did it this morning. So it helps calm down your nervous system, which obviously after surgery, anything that helps, get you in a more parasympathetic state is best. And then we do have newer lymphatic massage devices from New Zealand called Plopresso. So
Oh,
they
that's
do your arms, your legs, your kind of abdomen area, and then I don't remember specifically if you had this problem, but some people get really cold. So
okay.
this one has a warming function.
Oh,
So
very cool.
it's more soothing if you want to do that. And then we have some, the Nano V just blows by while they're getting it done. And it's a really good setup to then go into the hyperbaric chamber, for about an hour like you did. And then the red light's in there so you can stand in front of the red light. And I want to get a vibroacoustatory device because sound therapy is something that's
That would be
probably
so cool.
underappreciated. We just haven't added it yet.
Yeah, I needed that nervous calming device that you were just talking about. I was
It's
pretty
really nice.
going into surgery.
Yeah, certainly. Yeah, we're one of 3 clinics in North America that have one, and after we, trialed it, it was obvious that that would be a big difference maker for our patients. So I feel, you
That's
know, we always want to have, more access, and Miranda's in Los Angeles. She came here and spent a week in Austin, and people who come from out of the country now, we have them spend a couple weeks. Anybody who can spend longer, of course, we want to do that, and we'll help accommodate. My team in the clinic is great, and although I don't have, we have functional practitioners, and I have several of them now that help run the program for the patients for detox. And then we have our nurse practitioners who run the surgical follow up. And each of the team members is led by somebody, or each team is led by somebody who's had explant with us.
yeah. Yeah, your team's amazing. Everyone was so sweet and nice, and it was just like such a comforting feeling because you're obviously probably a little scared going into it. At least I was. And everyone on the team is just over the top sweet and understanding, and it makes a big difference.
They're a great group.
Yeah.
super fortunate. They take and great care of the patients.
Yeah, they really do.
There can be people who don't like me, which is fine. I'm all right with that. But nobody should complain about my team.
Yeah, you got a good team around you, and you're great too.
Not everybody's cup of tea, but so. What I wanted to know is I've tried to always ask, and you can decide like how, if you want to share this part, is
Mhm.
what convinced you in the initial run up to getting an augmentation? Like what kind of maybe discussions did you have? Because now you've had a fat transfer. Like,
Right.
did you get offered a fat transfer as a form of augmentation, maybe when you were learning or looking at getting an augmentation?
No, honestly, is this something that's been done for a long time? Is fat transfer to the breast?
I have. Yes.
Yeah. Yeah, I mean, no, I've never even heard of it until honestly like a year or two before my explant surgery when I was like, what other options are there? Because
Right.
naturally I'm like a double A and I was like, I don't want to be that flat again. So what are my other options?
Right.
And that's how I found out about it. But I feel like it's not really talked about or known about, to be honest.
It's interesting. I mean, everybody's heard of the Brazilian butt lift, which is
Exactly.
moving fat, to the butt. And this is my staff who are always funny. They call it the Brazilian boob lift,
Yeah.
because you're just taking the fat and moving it to the area. But it's not where the implant goes. I think everybody needs to understand this. We're putting it beneath the skin, but above the breast, so it's in the space between the two. That's the fatty layer. It's
Mhm.
just not as big of a fatty layer as someone's butt.
Yeah.
It's a much bigger area, of course.
Yes.
So, if somebody wants to have bigger and bigger and fuller, breasts, however we're going to characterize that with fat, you'd have to do more than one transfer typically. So it's everybody's prerogative. It's your own genetic material. So of course you could do that. People
Yeah,
have more than one Brazilian butt lift.
totally.
That's not uncommon. I don't know why the breast thing has become such a,
I know, it's not really like I don't know, I feel like it's not like common knowledge that you could do a fat transfer to your breasts.
yeah. I think for us, I mean, I've been doing fat transfers to the breast since '04, maybe '05,
Crazy.
and mostly for cancer reconstruction purposes. But I mean, augmentations work well. It's not ever going to be like an implant because an
Right,
implant,
it looks different.
yeah, and it's implants push out, and fat can't do that. So
Right.
if you just want more of a naturally larger appearing fuller breast, then that's
Yeah.
totally, fat transfer is good if you have fat.
Mhm.
Obviously, for the folks who are tiny or just low BMI, then that's usually not going to work for them. But
Yeah.
there's a whole host of people who didn't get offered, or that explanation was never given to them. So,
Right, and I feel like even if it was offered to me, I didn't know about BII, so even if they were like, "Oh, we could do a fat transfer," I probably wouldn't have done it because it sounds more invasive, but now knowing what I know now, it's like, that's kind of the obvious choice in my opinion.
right, and yeah, it's just, to your point, like it's what you know now. Yeah,
Right.
like people always like, I have a 17-year-old daughter. They're like, Dr. Whitfield, what if your daughter wanted implants? I'm like, well, first of all, my daughter's a Leo like me. You can't tell her
Yeah,
anything.
I'm a Leo.
There's no chance you're telling my daughter what to do.
Yeah.
So if she's decided that she's gonna have breast augmentation, then she's gonna go figure out, just like Madison did, how to do and get a breast augmentation. I was like,
Totally.
nothing that I say, nothing that I've written about, books, 130 podcasts, whatever I've done,
Yeah.
appearances I've made, uh, webinars or whatever. That doesn't matter.
Yep.
Young people are going to do their thing.
I do think it's important, and this is why I've been so open with my experiences because I just feel like when I made my decision to get my breast done, this information wasn't out there. Like no one was talking about it. I didn't even know it was a thing. And I have, through sharing my story, have women reach out to me and be like, "It's because of you I decided I'm not going to get
Okay.
implants." And I feel like that's the whole reason I'm open about my experience. It's not to scare anyone. It's just to inform you, and then you can make an educated
Right.
decision what you want to do with your body.
Right. Well, now I've bothered enough people that people are making funny videos about me. And
Really?
Oh yeah, yeah. I've become, what do they call those? Not memes, but they just put me up and talk about me now because they're like he's crazy or he's whatever, which is fine. I clearly am doing the same things, right? I'm just trying to share what we know and educate folks. I'm not. Somebody said I was fear mongering. I was like,
Oh my
no,
gosh.
yeah, that's what I do. That's what
People just want to say that so they feel better about their own decisions. And you know what? I'll say the first video, how I found you was when you did the Skinny Confidential podcast. And there was a clip of you that was going pretty viral when you were talking about girls who go into the sauna and they're melting their implants. And I was a sauna girly. I am talking, I would go 2-3 times a week. And every time I would do the sauna, I would feel so sick. I would have a headache for the rest of the night. I would feel nauseous. And I'm like, well, clearly I'm detoxing. And when I saw that video of you, I was like, it just all clicked. I'm like, no, I'm not detoxing. I'm actually putting more toxins into my body. This is insane.
All right, so Madison has opened basically Pandora's box, and which is why everybody who is a plastic surgeon who does implants, and when I say what I said on that show, so Lauren Bostic's show, you can go to the Skinny Confidential episode, just type into YouTube Dr. Whitfield and Lauren Bostic, and it's going to come up, and it's going to say what Lauren would say to me in office is like, Dr. Whitfield, I think I was melting my implants, and we would joke about it. She's a very good interviewer. Her and her husband are very good. She said, "Are you going to say, or do you want me to say it?" And I was like, "What?" And then she led me to say, and I did say, melting your implant, but it's not the correct term. So let's just clear the air. The correct term for what she was doing was called leaching. So if you heat up something, think of like a plastic water bottle. If you heat that up, the plasticizers, the things that make the plastic hard, are phthalates. Those phthalates will leach out of the plastic water bottle into the water, and then you'll drink the water and you'll increase your phthalate level. So what she was doing was getting overheated. The shell components, the heavy metals in the shell, were leaching out of the shell into her tissues. And she would feel terrible, just like you're talking about afterwards. And Michael said she would do it for an hour and a half at 212 degrees.
Oh my gosh.
And I was like, okay, well, that's clearly not good. And what Madison is describing is called a Herxenheimer reaction. And that's when you are detoxing too rapidly for your body to accommodate it. So it can give you viral type symptoms, or if you want to think of flu-like symptoms. Madison's describing a headache, very common. More fatigue, very common. So it's not made up. I'm not fucking crazy. I'm not trying to scare anybody.
No.
And I tell all my patients the same things. If you feel bad after you get out of the sauna, then don't go back into the sauna.
Right.
Come on. Like, this is not rocket science.
Right. But I thought I was detoxing. I'm like, oh, I don't feel good because I'm detoxing. This is amazing.
Well, that's the point, right? So if it's not a refreshing thing after a period of time, it's more of a like, I feel worse, then you probably should just hold off.
Right.
And then people are like, well, Dr. Whitfield knows that an implant can't melt. He just said that, caused all this shit, and he's fear mongering and all this other stuff. And I'm like, no, not really. I have all the receipts for this. I would never say anything to scare Madison about the sauna. Totally. I would want to inform a patient that potentially that device is leaching chemicals into her system, and things like tin and cadmium and platinum and all these things that are found in the shells can definitely cause problems for you. They can cause neurologic problems. They can give you other, metabolic issues. So that kind of stuff bugs me.
Yeah.
Because folks are not interested in safety at that point.
No, I mean, people don't want the truth when it comes to health because they just want the easy way out. So if you're saying like, oh, implants are X, Y, and Z, of course people are going to come for you because it's not what people want to hear.
Yeah. And I have, there's newer implants on the market now, and those are supposed to cause problems. And I have a set sitting on my desk that I've already taken out of somebody.
Yeah.
Every one of them will ultimately affect somebody.
Yeah.
And it's, come on. Anybody who puts in an implant, hip, knee, breast, dental, like, look at all the dental stuff. Oh, my goodness. The dental stuff is out of control.
Yeah. Everything's connected. For you to think that you're going to put something foreign in your body and everything's going to be 100% A-okay is just probably not the reality.
No, you always got to be thinking about and mindful of those things. Like
Well,
everything you put in your body and on your skin is gonna, there's a consequence. So,
exactly. Yeah.
well, I guess going back to your young self, like you
Hmm.
said, you wouldn't have probably done a fat transfer because it probably couldn't have been explained in a way that would have taken away its invasiveness or extra
Hmm.
surgical component, because there is, right?
Yeah.
I always am trying to just explain it as I do it this way. So if you're, say, in your 30s and you've had children, we'll just say that's the case,
Hmm.
and you don't want to have an implant, but you want to have a better looking, fuller breast because you're breastfed and it's a little deflated.
Yeah.
Fine. And I say, well, you can take fat from your waist, your thigh area, and basically get the body contouring, procedure and use the what would be excess or thrown away. If done correctly, you just put back. It's your own tissue. It's your own genetically identical cells, and
Hmm.
so all things being equal, that should be the best filler.
Yeah.
It's not foreign. It's not going to get rejected. People ask me like, how often does something um, leave a cyst, which can happen.
Hmm.
Everybody's seen oil. You can
Hmm.
get an oil cyst and kind of get firm. Yeah, that's a. I would say that's uncommon, and we can hear Madison discuss what she thinks about how it feels. Does it feel natural? Is there problems with it? And I have nothing to hide. I mean, anybody can have a problem with anything I've ever done. That's totally fine with me. But in general, fat transfers, because they're your own genetic material, to me are the best filler.
Yeah. I
So
mean, I think any girl who has implants could probably relate to this. They feel so uncomfortable inside of you. Like when you are hugging someone, for example, I would always concave my shoulders because if someone pressed too hard against my chest with my implants, it would feel uncomfortable. I couldn't lay on my stomach. It just you always are like kind of like protecting your chest when you have implants. So yeah, the fat transfer is way better. I'm a hugger, so to be able to like hug people without pushing them away at the same time with my shoulders is really nice. Being able to sleep on my stomach again, all of that, I'm way happier with this. Um, yeah, and they feel natural, and you can wear a push-up bra and kind of make them look like implants if that's your MO, and that's what I do. And I think it's fine. I think it's great. I think it's the best option. And from
well,
what I know now and having both, I'm really happy with this outcome.
we always used to have the same. I had this expression like a plastic surgeon that should not try to make cleavage. That's
Mhm.
what a bra does.
Yeah.
And the moment you're trying to do things like that aren't really, um, they're not really a natural way to do something.
Yeah.
And obviously, I end up trying to do my best to correct many of these, in surgery. Like we try to maneuver the muscle around if we can get it back and repaired. We try to add fat, or we can do different lifts, and there's all sorts of things I can do to kind of make up for some of these implant things I find. But in general, I guess my summary would be if I could do an operation similar to what I did for you, Madison, each and every time, that's probably the biggest win I could have for a patient, where I take volume out. If we can get the muscle repaired, we do all that, and then add volume back with their own
Hmm.
fat. That's probably the best
Yeah.
situation.
Yeah. I was really happy with it. I also am really happy I did it in one surgery because for me personally, if I would have
Right.
woken up with a double A chest, I would have been distraught for months. So,
Well, and that's, we talk about that. That's why I said if I had my best case scenario in every situation, and that's why the program is set up.
mhm.
For a while, um, it was really complicated because I was getting a group of patients who had more and more toxins in their system, more and more problems. And um, Lauren actually didn't want to have a fat transfer. She was going to have another child, and has went on to have another child
Mhm.
recently. So we didn't do that for her, and I doubt she'll ever have one, to be
Yeah.
honest. But to your point, it would be a win in a number of ways, as you were describing, probably emotionally and psychologically, a win to wake up and have
something.
more volume. And that to me is always like uh, the it is the best case. Like if I can do that all the time, I feel like that is the it's going to help the patient, if I can do it that way the most.
Yeah.
So. Well, what are we going to expect from you for the holidays? I've been checking out your Instagram. What's coming up?
Just lots of allergy-friendly recipes and traveling to go see my family for the holidays, and looking forward to celebrating my 2-year explant. I also just want to say, before I did my explant, I threw myself a Tata Titties party. Highly recommend it for anyone. I got a boob cake, I got boob balloons, boob straws, boob confetti, and I just made it a whole fun celebration, and highly recommend for anyone else doing the same thing.
All right. Where can folks follow you? Especially, I follow Madison to learn about recipes. Now, y'all can follow her for recipes and all of her other content.
Yes, oh, 1 second, sorry. You could find me on Instagram at madison.miranda, and that's mainly where I'm at. I'm on TikTok as well, but mainly Instagram.
Awesome. Thanks for hopping on.
Yeah, thank you so much for having me. It's always great chatting with you.